Now, amid an alarming COVID-19 surge in China, the centre has stepped up vigilance here in India. The Niti Aayog has issued a fresh advisory recommending everyone to wear masks and has also advised states to ramp up testing as well as surveillance. However, there will be no change in aviation guidelines, at least so far, or any restrictions imposed during the coming festive season as well.
18 के ऊपर प्रिकॉशन डोज सबको लगनी चाहिए, लेकिन लगी है सिर्फ 27-28%। तो हम अपील करेंगे कि प्रिकॉशन डोज जिसको नहीं लगी है वो ले लीजिए। ये भारत की पेंडेमिक रिस्पांस का एक पिलर है। उसकी एडवाइजरी अभी भी हम क्या कहते हैं कि अगर हम क्राउडेड प्लेस में हैं, चाहे बाहर, जैसे मैं अब क्राउडिंग में आ गया हूं, तो मुझे मास्क लगाना है। अंदर भी अगर क्राउडिंग है तो वहां भी हमने मास्क लगाना है। इसी प्रकार सोशल डिस्टेंसिंग की जो एडवाइजरी अभी तक है आपके समक्ष, उसका ख्याल रखिए। ये मास्क मैंडेट जो है अभी भी यही है जो मैं कह रहा हूं और उसी को ही रहना चाहिए। अगर जरूरत होगी तो गाइडलाइन को इम्प्रूव करेंगे। वी आर कॉन्स्टेंटली वॉचिंग। देयर इज नो डिसीजन विद रिगार्ड टू एनी चेंज इन द एविएशन गाइडलाइंस एज ऑफ नाउ। अभी जो गाइडलाइन है वो चली हुई है, हमने वो मैंडेटरी टेस्ट हटाया हुआ है। एज ऑफ नाउ देयर इज नो चेंज।
So let me in fact go across to Akanksha, an important piece of news coming there, Akanksha, where of course the authorities are asking people to be cautious as well as vigilant, but at least so far no change with respect to aviation policy being considered or stopping any flights coming into India from China despite the alarming situation there.
Well, absolutely. The Health Ministry today conducted a high-level meeting to review the COVID situation in the country. This comes after many cases were reported in China, Japan, Brazil and the United States. After the meeting, VK Paul, who heads the National Task Force on COVID, told media persons that a slew of COVID protocols have been announced by the Health Ministry. Firstly and foremost, saying that people do not need to panic, they just need to be cautious. In crowded places, people need to wear masks both indoors and outdoors. He went on to say that the surveillance will be increased, the testing will be increased, and most importantly, booster dose, as far as the booster dose is concerned, only 27% of the population has received the dose, and that is why the vaccination coverage will also be increased. As far as the aviation guidelines are concerned, VK Paul told us that there has been no change in it, and as we know that the festival season is coming up with Christmas and New Year, there is no restriction on people, but most importantly he has mentioned that in a crowded area people have to wear masks both indoor and outdoor. Ministry has also asked the states to ramp up the mask mandates. In various states the mask mandates were lifted just some time back, and now this is a direction to the states to stay vigilant and impose those mask mandate. But the most important point that the Health Ministry mentioned today is that the BF7 variant that is quite prevalent in China and is causing havoc there, the ministry said that 3 of those cases were reported also in India in the last 3 to 4 months since September through genome sequencing. So that is an alarm for India. That particular variant is causing havoc in China, and 3 of those cases have also been reported in India. But if we talk about the number of cases in India, the situation for now is normal, but the Health Ministry has cautioned people that even though they don't need to panic, they need to be vigilant, they need to be cautious, they need to wear masks in public, the testing surveillance will be increased, and the vaccination coverage will also be widened by the Health Ministry. As I told you, this comes at a time when the cases are on the rise, even in our neighboring country, China. If we talk about China, there are a lot of cases and deaths being reported there. There's the country is running out of hospital beds, and also the pharmacies are also running out on essential
like you said, Akanksha, an extremely alarming situation in India, but the authorities here are on their guard. In fact, let's also listen in to what Dr. N.K. Arora, the chief of the COVID-19 task force in Tagi, had to say about the preparations underway in our country.
It is an important thing that we keep a close vigil on Chinese situation. And but I would say that there is nothing to be panicked about. There is no need for getting too much worried on this issue. The system is very vigilant. We need to be very vigilant as far as genomic surveillance is concerned. This is the most important part. So overall, we find that the situation in India is under control, and but we need to maintain vigil, particularly for surveillance.
Now, following the central government's advisory, several states have now swung into action, with Maharashtra ramping up genome sequencing of positive cases so far. Karnataka has also said that a strict vigil will be kept at airport arrivals as well, and the state will also, of course, be sending all positive cases to INSECOG for genome sequencing as well.
Indians are quite safe because of the effective and successful implementation of the vaccination. When 100% of our population is completely protected with the vaccines, with double doses, and we have also started third dose as a preventive dose or a booster dose. Even those people who have not taken third dose, I appeal to all of them to take this booster dose at the earliest.